As parents and caregivers, we all strive to protect our babies from harm. But if we're impaired by alcohol, medication, or drugs, our baby's risk of SIDS and suffocation goes up. If we are impaired, our judgment, awareness, and alertness may all be altered. In other words, we may be more likely to make risky choices that we usually wouldn't, miss signs of danger, and fall asleep when and where we shouldn't, like with our baby. Impaired judgment or drowsiness may lead you to bring your baby into bed with you, even without the intention of falling asleep. You could accidentally put your baby in an unsafe sleep position or location without realizing it. If your baby starts to show signs of distress, you may not recognize them as quickly, and even a small amount of alcohol, marijuana, or seemingly harmless over-the-counter medications like Benadryl can make you sleep more deeply. This significantly increases your baby's risk of accidental suffocation if they were brought into bed with you. All of these risks leave your infant vulnerable, so the best guidance is to be aware, not impaired, when caring for your baby. And if impairment is ever a possibility, be prepared with a plan to get your baby to sleep safely. Your plan for safe sleep should include 1. A trusted adult, someone who can watch your baby and respond to their needs in your place. Make sure this adult knows how to practice safe sleep. 2. A separate, safe sleep space. Your baby needs their own sleep space, with nothing in it, including you. Babies that die while their caregiver is impaired are most often sharing a sleep space with that adult at the time. And 3. Emergency contacts. From trusted family and friends, to 911, to overdose prevention hotlines, anyone who can send help should you or your baby need it. Keep their information on hand. Navigating substance use as a parent is a reality for many. Instead of feeling judgment or shame for this, we want you to feel prepared and empowered to protect your baby. This message is for everyone. Whether you struggle with addiction, are on the road to recovery, or consume alcohol, medications, or other drugs, even casually, it's crucial to take extra precautions to keep you and your baby safe. And remember, if you are on any medication and you notice increased drowsiness or difficulty staying alert, it's essential to consult with your healthcare provider, as adjustments may be needed to ensure both your well-being and your baby's safety. To learn more, explore the Cribs for Kids Safe Sleep Academy. So every baby wakes from every sleep.
Hello, and welcome to the first edition of Cribs for Kids 2026 Safe Sleep Champions Quarterly Webinar, kicking off another year of this free series. My name's Devin George. I'm the program officer here at Cribs for Kids, and I'm joined by my colleagues who you can't see, Andrea Wilson, Shayla Grady, and Kelly James, who are running the show behind the scenes. As we did in 2025, we start the new year with Safe Sleep Champion guest favorites, Doctors Kyran Quinlan and Gina Lowell, giving our viewers what they asked for, more of these two doctors. We also welcome a new champion guest today, Dr. Mary Beth Howard, a pediatric emergency medicine physician, public health researcher, and injury prevention expert at Johns Hopkins University. We'll talk with them all in about 10 minutes, so let me get started. If you're joining live, your mic is muted and your camera's off, while chat and Q&A are both available. Chat is for messages to our staff. Something's going wrong, you have a quick question. Q&A is for questions for our guests. With just one precious hour and so much to talk about, we don't take questions live. Instead, we ask that you type your questions into the Q&A feature. Then at the end of the hour, we send all those questions to our guests for their answers. Then all those questions with their answers are sent back to you via email for anyone who registered for the webinar, along with the link of the uploaded recording. Because while we're live for this session, which you'll see as I stumble over my words in a second, we record each webinar to upload to our YouTube channel and video library. That means you can review something you may have missed or share with like-minded colleagues. And after today's session, we will have a huge library of 18 Safe Sleep Champion webinars available for viewing. Before we talk with our guests, let me share what's happening with Cribs for Kids. Normally, I'd start this January webinar with our accomplishments and metrics from the last year, the growth of our programs, the use of our free education, how many crevettes we shipped and donated. But moving forward, we're sharing all of this and more with our annual report that was released in October's Safe Sleep Month. Let me show you that here in a second. There we go. That makes it align with our fiscal year too. So poor Andrea only has to do all of this once. So we released our new annual report last October for our 2024 to 2025 fiscal year. You can see it here. You can link to it on our website, and we'll do the same this October. We hope you'll take a look at it. It really showcases the depth and breadth of the work we do here, thanks to our team, our thousands of partners and collaborators like all of you who are watching. So that's 2025. See how fast that was? So let me share what's on deck for 2026, and then we'll talk with the doctors. If you logged in at the top of the hour, or you're watching this recording, you saw one of our 4 brand new education videos that we released in 2025. We created these in support of the child welfare training that we did for our state of Pennsylvania, and now they are available to everyone else via our Safe Sleep Academy video page and our YouTube channel. If you watched it, you saw it's a video with unique, frank content speaking to the challenges of those caring for infants with the highest risk of suffocation and SIDS, and those caring for infants while they themselves are struggling with their own substance use. These videos support our new professional training series, and this is one of the really big things happening at Cribs for Kids this year coming up. In last July's webinar, you met Spencer Poston, who joined our team to develop this new free advanced series. Building on our Safe Sleep Ambassador, the professional training modules are developed for specific professions and with the support of our program advisory board. We have them now for those working in child welfare, child care, and his home visitors. Those modules available right now, and today, we are launching our first responder edition of the professional training series. Again, free, specialized, on-demand training that recognizes and supports the really unique role that firefighters, paramedics, EMTs, police officers play in their communities when it comes to infant-safe sleep-related deaths. The new module outlines when and how to talk about infant-safe sleep to prevent suffocation and SIDS when they're on a call. It helps to guide those conversations, how to approach it, how to take advantage of the opportunity they have when they're in the house, when they've solved the reason that they're on the call. And it also talks about how to support families on the worst of the calls that they're on when a baby has died. This free first responder module was reviewed and very much improved by our program advisory board. Thank you to them. That includes members who have done this work in the field. It's their expertise and experience that ensures these trainings are appropriate and impactful. The first responder professional training module is a significant addition to our National Public Safety Program, with more to come as we are always developing new client tools. Then we will publish the 2 more modules later this year. In April, we'll release our nursing and healthcare module, filling the gap left with the closure of the NICHD Safe to Sleep program. And in July, we'll publish a module to support doulas. And then this fall, it's a Cribs for Kids conference year. Please join us in Pittsburgh from September 29th to October 2nd for our 9th National Conference. Safe Sleep, Rooted in Evidence, Branching into Action. Abstract submission and registration opens today, any second now. Shayla, whose name I mentioned earlier, is working behind the scenes on this webinar and getting that registration, testing all of those pieces there. So that abstract submission and registration will open today, which is January 22nd. I've only experienced our conference virtually, and they were awesome in 2022 and 2024. So I really cannot wait to have so many people here in person. So many of you have been asking, when will you go back to in-person conferences? Okay, we heard you. We will. Side note, Pittsburgh is one of the 25 cities National Geographic has on their must-visit destinations for 2026. Yeah, Pittsburgh. So while you try and verify if what I just said is true, and of course it is, join me in welcoming our Safe Sleep Champion guests, Doctors Kyran Quinlan, Gina Lowell, and Beth Howard. To maximize their time, we are skipping the long introductions and pointing you to our website to learn about them. If you are new to infant safe sleep and not familiar with the amazing work these 3 docs do, please take a read. If you aren't new, then you know them to be committed safe sleep champions, translating all of the research that they do and that others do into practice, working tirelessly and with innovation to reduce infant safe sleep suffocation deaths. They do this every dang day. So thank you so much for joining us again. Let's see, we're going to ask them to go ahead and turn on their cameras and unmute. There they are. There, look at that. Nice. All right. Thank you so much for joining us. My job is super easy for this webinar. I usually just kind of say go, and then all of us listening are going to learn something new or hear what we already know presented in a more compelling and actionable manner for real. I learn something every time I talk to one of you. So let's be sure what I kind of just want to set the stage because we're talking about what we learned in 2025 that will be impacting what we do in 2026, right? So I want to be sure those that are watching are familiar with the unique challenges that were presented in 2025 when it comes to SUID. I mentioned one before, the shuttering of the NICHD Safe to Sleep program, the Health and Human Services unsuccessful move to defund the American Academy of Pediatrics Research, and even the vaccine schedule changes. So we'll start there, say hello to everybody, and then I'll let you guys have at it to talk about the impact of those.
Sounds good. Hello, everyone. Great to be here again. I'm Gina Lowell, pediatrician from Rush in Chicago.
And I'm Mary Beth Howard. I'm a pediatric emergency medicine physician at Johns Hopkins.
And nice to sort of see everybody, but I'm Kyran Quinlan, general pediatrician at Rush in Chicago as well.
So yeah, so just, jump in, talk over each other, right? I know you're much more refined than that, but so we know about the AAP having their funding restored and the NICHD shuttering that Safe to Sleep program. But if you could each talk about maybe how that's impacting your practice or the work that you do or your perspective on infant safe sleep.
Absolutely. I can start us off perhaps. I think it was terribly disappointing to see the Safe to Sleep campaign, knowing that they'll move forward unsupported or with less support. And I think as pediatricians, we're always also very cup half full and think about, well, what's the opportunity here? What's the opportunity if we know that from a national perspective, there may not be that ongoing support? What's our responsibility in this moment? And what are the kinds of things that maybe we were hoping or dreaming to do that now this is really the push to go ahead and say, yes, we can actually do those things. I think the terrible issue with it is that along with that individual work that we do with families, communities, agencies, to have a national campaign is so important when it comes to public health priorities like infant safe sleep and preventing SUID. So I guess I kind of hold both of those things at the same time. It's both a real loss and also there's opportunities in here that we can really take advantage of.
Yeah, and I think the way that I look at it when we talk about sort of what's new in 2025 and Cribs for Kids really offers a safety net for families and for providers who care for families. But that safety net is weakened, right? We've lost sort of our trusted national voices with the shuttering of the Safe to Sleep campaign and through potentially reduced support through the AAP and other federal funding mechanisms. But I do have hope in that as we work together to identify novel areas of prevention or understand individualized risk better, since prevention may get more complex, but we're sort of, agencies like Cribs for Kids are working hard to coordinate that. I think with the vaccine schedules, we all have different perspectives on that. I think it's going to make taking care of kids a lot harder and more complex, both from the primary care standpoint and the Gina and Kyran can talk about the increased counseling that's going to be needed. And then when I see sick kids in the emergency department, we're going to have a lot more sick kids. And we know that illness is a risk factor for SUID and taking that into account when we're counseling families and doing population-based prevention efforts.
I'll just add in, Gina and I were on a meeting with two people from the American Academy of Pediatrics National Office just the other day. And it was actually really nice to hear from them that, yeah, their funding got threatened and then it got returned and all the programs are now back going. And it was really nice to hear that. a little bit of good news in what's been really a difficult time for public health. It's a home number of things that are kind of undermining what's been going on. But I also totally agree with Dr. Lowell's idea that the Safe to Sleep campaign losing its funding it's a big deal. That's a national campaign. There's resources that without funding won't be able to continually be updated, and that's important. But could this maybe be seen as the thing that spurs us to think brand new on this topic? And with the lack of progress in the last 25 years, we've had like 3,500 babies die every single year in 25 years. I think we absolutely have to think some very new thoughts. And this could be kind of like a maybe a blessing in disguise, sort of like, let's kind of rethink what we could do that actually can drive these numbers down.
Yeah, I wonder how much was that pushing you, Devin, to create that new content that you have, those 4 new videos? I'm really excited. I already texted our team like, hey, we've got to post this on our Instagram and things like that. And as well as the first responders training, sort of those specialized trainings that you're doing are certainly beyond maybe things that we had been seeing out there nationally.
Yeah, I mean, this was our long range plan, and so they were always on our docket. It just, takes a while, right? We have a
Yes.
small staff, so when we were lucky enough to have Spencer join, so we knew that was a gap that needed to be filled. And certainly when the NICHD, we have a hospital certification program here, and as part of that, which I think you all know, since both of your hospitals are certified, that part of that is having your healthcare team members trained in infant safe sleep, and we always relied on that nursing module for the NICHD. So when that's not being updated and it's not current, we did have to kind of scramble back, and so that's why we're doing that nursing one. We moved it next in line, so we'll get that filled. So certainly it has an impact. I mean, it has an impact in that they were the conveners and we could all go there. But you're right, it gives us a little bit more freedom, I don't want to say freedom, but maybe flexibility to say, okay, we don't have anywhere to turn to nationally, so let's locally, what are our challenges and what do we need to speak to? So yeah, those videos were from a separate project with our state of PA, working with the child welfare workers. So we were thrilled when they said go ahead and push those out to everybody. So it does seem though to kind of chip away at the significance of the deaths of these number of infants, right? So where is that national voice on that? And even something as simple as, not simple, complex, that you wouldn't think would immediately impact infant safe sleep, that change in the vaccine schedule, where the federal government says one thing and the AAP says another, leaves those families walking into your offices. And so, Gina, you had expressed how that impacts your day to day, and even Dr. Howard, who you see coming in. Do you mind sharing that with everybody?
Yeah, absolutely. One of the things that we've talked about previously is how much time, in our 20-minute visit, do we spend counseling regarding infant safe sleep and suicide prevention, given that it is the leading cause of death for babies once they're discharged home from the hospital? Are we spending the correct proportionate amount of time in that counseling or not? And we've been turning that up and tuning it up and really raising awareness, like, hey, let's reconsider how we spend our time. Well, now with the federal changes to the vaccine schedule, and our, as the AAP, we continue on with the vaccine schedule that is evidence-based and has been shown to be safe and effective. And knowing that those federal changes have occurred without any change in the safety or efficacy evidence that exists, you are right. We've got families coming in with many more questions about vaccines, more hesitancy, and less acceptance. And so now we're spending more of that time with counseling towards vaccines, which is totally fine and also life-saving, but it draws away from the time that we really need to be spending on safe sleep education and suicide prevention. And so we've swung the other way now. We've got we're back to that little bit of an imbalance in how much time do we have to talk about safe sleep and suicide prevention.
And if they're not seeking counsel or not trusting what they're hearing from their medical provider, then they wind up with you, Dr. Howard, right?
Right. And I think it plays out in a couple different ways. The first is we know that illness is a risk factor for SUID. So if more babies are getting sick, their risk of SUID goes up. And we'll see over the next few years how that plays out. Also, if our volumes in the emergency department and urgent cares and inpatient units goes up, we also have less time to deliver sort of individualized education to families. I work with some groups locally and nationally to try to think about how to deliver safe sleep education in the ED and urgent care and inpatient settings. But if we're having to take care of more sick kids, that time, and when our clinical volume goes up, that time goes away.
Yeah. Yeah, it's difficult to understand the logic behind those kind of decisions, shuttering the NICHD, risking taking away research fund from the AAP and the vaccine schedule, particularly when, you know, we talk about the frequency of these deaths with which Dr. Quinlan just mentioned. So I do like this, you know, when you talk about the infant deaths, 3,500 every year for babies ages 0 to 1, and then look at it against all of the other deaths that happen to a juvenile population. It's gaspable, right? When people see this. I've been in the room where you guys are presenting and you talk about it, people go, oh, and if people have gone back or joined us for the first webinar where you talked about how you get people to picture this frequency, this huge gap. So I didn't know if you could talk a minute about these deaths. How do we count them? How do we understand them? So, you know, this is where I go ahead, talk amongst yourselves now.
Well, if I'll chime in here that this is it is shocking when you put the number of deaths from sleep-related infant deaths in context with other major causes of death for kids in the US, where the total number of homicide deaths in all of childhood from birth to 19, the total number adds up to like 10.7 deaths a day. That's homicides. And that and motor vehicle are like the top. But for sudden unexpected infant death, everybody on this webinar can do the math. If we have 3,500 in a year, it's around 10 a day. And that all happens in the first 12 months. Somehow, one problem that only has 1 year to occur is killing as many children as all of childhood homicides. Homicides make the news. We hear about them all the time. We hear about car crash deaths that kill kids. We never hear about sleep-related infant deaths. They're not in the papers. They're not on the radio. They're not in 10 o'clock news. And our brains work where we estimate the frequency of an event by how easy it is for us to recall a recent one. So if you have somebody down the street that their child overdosed and died, you have a 17-year-old home that you are now living in some fear because you know it kills kids. You know that is a nightmare, and your behavior completely changes. You think about who are they spending time with? Where am I going? All these issues, right? And the behavior of families when they are uninformed about the relative frequency of SUID it's like they're not prepared. They don't feel this risk the way you feel the risk of your 18-year-old getting the car keys for the first time. You feel that risk and you wait up till they get home. But for a 3-month-old who's just around the peak for sleep-related infant death, if that baby's crying, your behavior is actually in the opposite of safety by bringing the baby from their safe bassinet into the bed with you, hoping you can get more sleep. We have a lot of work to do to help families be more prepared by understanding the real risk of this, that this is the towering risk for a baby after they come home from the hospital after being born. And there's a lot that they can do to protect their baby from it. I really think that that risk perception issue affects parents for sure, but I really feel like it affects us, clinicians, pediatricians. We give this kind of talk to pediatric groups, and there's gasps also. People aren't aware of this. They are not informed of the deaths of their own patients. I found out about my own patient who died after 2 months, the 2 month visit, the day after the baby, I saw the baby died of this. And I only found out because an OB/GYN colleague came and found me in clinic weeks later, and I would have never heard. So without us being informed about these deaths, we don't have a good estimate of it either. And I think public health probably, the whole world of public health probably doesn't have the investment that it deserves, in part because of this poor risk perception of this huge issue. So I think there's some room for leverage on like working on this in all these layers of the parents, of the providers, and of public health to try and move this in a new direction. I think it's got possibilities.
I think that's a really important lesson learned for us from last year, as you know, and the theme of this webinar is that addressing risk perception makes a difference. We certainly hear from providers. So we run the sudden unexpected infant death case registry for Cook County here in Chicago and the surrounding areas of Cook County. And one of the efforts that we started doing in 2024, as you guys may know, is getting our data back to the hospitals who cared for those infants, discharged them, and then they subsequently died. And before this process that we put into place, there really was no way for providers to hear about the infants that they cared for who subsequently died. When we take that information to them, not only the rate and frequency and circumstances of suicide in Cook County, but actually case-specific information about circumstances that happened to those babies. It's like a whole new level of awareness and action that you see start to come from that really important connection of data or closing that data loop. It was such an important lesson for us, hearing back from providers, getting feedback from them after they sort of hear about the circumstances of their suicide deaths, that this year we're moving forward to get that data back to the clinic providers, primary care pediatricians, but also home visiting nurses as well. So really anybody who's been taking care of an infant. Of course, we try to raise awareness and get to all those agencies and groups. But this whole piece of bringing the specific data back to providers who cared for those infants in clinical settings is going to be a big part of what we're doing in 2026.
Can I just add one more thing on top of what you just said, Gina? And that is the persuasiveness of promoting vaccination for the baby shots was really enhanced by the fact that there's a bacteria called Haemophilus influenza type B that used to kill a lot of kids. And any pediatrician would know all about this, and we'd see kids in the hospital. But you'd watch that child go from being a healthy, perfectly normal, happy 6-month-old, 12-month-old, and then they're getting a fever, and then they get very sick. They go in the hospital, they go maybe in the intensive care unit, and they die, and the blood tests are all showing this bug, Haemophilus influenza type B. It used to happen. Then we got the shot. And the persuasiveness of our counseling to get that shot was informed by the fact we watched that happen over and over. It's the exact same thing. The more information we have, because the deaths, these sleep-related infant deaths, that was a perfectly healthy child I saw at 2 months.
Mm-hmm.
Their autopsy was normal after their death. I didn't see that child get sick and die, but they died at home. And without knowing that, when I try to counsel the next time for a family who's bed sharing, how persuasive can I possibly get? I don't have all the information about what's really going on with my own patients. So the closer we are to this information, the more we can kind of stop everything at the checkup and clear a little time to make absolutely sure that the parents who love their child understands this is, no, I'm not kidding. This is a really big risk. This killed one of my kids the other day, or something like that. We do never mean to demean or diminish the importance of these other causes of deaths when we make comparisons from sleep-related infant death to, say, homicide or overdoses, but we do want to put them in context. And just really quick, think about the huge measles outbreaks lately. I know in Texas, that big one, there was a total of 2 children who died of measles, both of which are tremendous tragedies. And it's so sad because that's very preventable. We had 8 sleep-related infant deaths in Cook County, Illinois in December. 8. None of them got into the newspapers. People did not hear about any of them. But if measles killed 8 babies in Cook County in December, it would be the front page of the Chicago Tribune. And people would be outraged and try to figure a way to stop this. So the more public attention to this, the better.
And Dr. Howard, you see the babies, right? They wind up in your emergency room when they pass. So you do see those. And I quickly put up our next slide, which is that when you talk, we're moving more into the injury prevention as we talk about sleep-related deaths, because these are preventable deaths, as you said, not with the vaccine, but vaccines do help to prevent them, but by following safe sleep, which isn't easy to do as a new parent. But, I just put up here, I think it's important for people who are on this call to understand that babies don't die when they're following the ABCs of safe sleep. So if you look at the deaths and the references cited here, I can't see that far where I'm looking right now, where this study, where the data came from here, but how often an unsafe sleep factor is present when you have a sleep-related death. So, do you have something to share on that, Dr. Howard?
Yeah, and I think so. Thinking about this in lines with like an injury prevention mechanism or framework, right? The ABCs of safe sleep should be like how we think about seatbelts for car accidents, life jackets, or pool fences to prevent drowning, and smoke detectors and home fires, right? So they narrow our margin for catastrophe. And I really think moving to this injury mechanism-based framing, and thinking about the mechanisms of harm, right? And thinking about this as a system issue where babies are dying at extraordinarily high rates moves us away from like vague warnings of there's this thing, SUID, that may, come in the night and take your child, to very concrete behaviors and environmental safety. Dr. Quinlan talks beautifully about changing from SUID, which is the outcome, to the mechanism, which is suffocation. And I think so much of our injury prevention frameworks, right? We talk about gunshot homicides, and we talk about the mechanism. And then we have sort of efforts in prevention that mitigate that mechanism. And for safe sleep, it's the ABCs. And so I think, again, that injury prevention mechanism, as we think about moving this forward, is going to be key.
Yeah, you had mentioned too about bringing forward some information into the public about unsafe sleep deaths. And I had this lovely investigative reporter from Consumer Reports. Somebody pointed her in my direction, Lauren Kirshner, and she was saying, "Hey, I'm just trying to put together some stuff for October Safe Sleep Awareness Month." And I'm like, "Oh, well, let me share with you some things that people are surprised to hear," and shared the way you all have shared with us about the prevalence and the injury prevention. She left that conversation with me, went to her editors and said, "I really need to do a bigger dive on this." And she did this fabulous article that came out, and she's like, "I'm really moving on this." It came out the very last week in October because she needed some more information or some more time to put it all together. I don't know if you've all had the chance to read this and the work that she did, which was really, it was wonderful to talk with her, and her interest was instantly ignited because she wasn't aware, despite being an investigative reporter for Consumer Reports and working in infant products. We are so honored that she took the time and dug into this and shared it like this. And there's the headline there that we like, right? The fabulous Dr. Mike Goodstein. We think that we'll start driving some attention to it as well. As you said, go from the mechanism, but away from the statistic, because I don't know, does anybody want to read the headline for me? Can you guys see it?
These aren't statistics. Oh, go ahead,
These
Gina.
are babies. This was a fantastic article. Thank you so much for tuning us into this. I think one of the areas in this article, which, maybe we will or won't dive too much into in this conversation, is in about the middle of the article, where she talks about what happens when you search, any search engine that's using some level of artificial intelligence in their search results, about, whether or not bed sharing is safe. Like, it starts off like, can you safely, or not can you safely, is bed sharing safe, right? And then that first question will take you to AAP guidance, no, it's never safe, et cetera, et cetera. But if you just make this very small change in your query, which is, can I bed share safely? Now suddenly there's all these returns about how to bed share safely. And it's the way she framed it was as when we use search engines, that they are value neutral. And that was it was very insightful, I thought a very insightful way of framing the difficulty with advice that is gained from searches like this. And I think really points us again to the challenges that we face when it comes to providing counseling and being trusted sources of information, and where parents may be looking for trusted sources of information.
I think the headline or title of the article really captures it, in that it's written not for experts like us and everyone on this call. It's written for families who really don't realize that they're navigating danger when they're turning to social media and online platforms, whether AI or other search engines, for this information. And it's not that families are actively choosing to ignore the ABCs or sort of clinician recommendations. It's that they're drowning in contradictory information that they get online and don't even realize that it is putting their infant in danger.
I just add one other implication of this. I thought this article was fantastic, and I'm so glad that this national outlet was used. And the writing, she did a very nice job. I also really like Mike Goodstein's that quote, as I'm going to credit him as I repeat it, because it's so true. But this is, with so much misinformation, and I mean, there's some people that for some reason are pushing bed sharing with sort of the idea of that breastfeeding is more successful. And there's this, I'm not going to open up this whole can of worms, but the whole sort of whatever people want to call it, perhaps a controversy or something, or the disagreement about this, don't you feel like we need the facts? Like, we really have to finally get somewhere where there's the facts of these deaths. And to do that, you have to have a system where you collect all that information on all these deaths. And vital statistics, death certificate data, only goes so far. On a death certificate, you can get whether they were a boy or a girl, how old they were, what race they were. What you don't get is anything you can do something about, which is like, where were they? What bed were they in? Were they in a crib, bassinet? What position were they in? Other circumstances in their lives that could have affected things. And so that system, CDC has been trying for some years to create that system, and about 40% of all sleep-related infant deaths are now in the system, which is the sudden unexpected infant death case registry. But it still has a long way to go to be a true surveillance system. So we have the facts on this, but this is all to say an investment proportional to the burden for this problem is direly needed.
Yeah, you can't solve a problem if you can't point to the numbers, or even point when you're being successful. Do you know what I mean? And 40% in our country, I mean, it really it's surprising to hear. I imagine everybody on this call is shocked to see how many babies are dying per day compared to how we lose other children. Shocked to see how often an unsafe sleep factor is present, and shocked to see how poorly we do in getting the data on where these babies are sleeping, how, what other circumstances, as you said, were there that we could do something to prevent those deaths. So 40%, I mean, that's failing no matter where you are, right? There's no 40%, C in there. So is there movement forward on that any of you were aware of to expand to that? And I know we didn't talk about this, so sorry for throwing that one out there.
It seems like we're trying to tread water with public health funding right now.
Yeah.
I don't think people are expecting new money, new investment, support for these types of things, but seeing if we can at least stay where we are.
Mhm.
The sudden unexpected infant death case registry itself has been threatened. So we're hoping to not lose anymore.
I think this is a good time for me to say it, is that means that what we're all doing locally is even more important, right? Because we don't have that national convener, because we don't have a national resource, because we don't have a national tracking system, anything we can do locally, like you all are doing in Cook County, and it's all that more valuable. And I think everybody on this call knows that, and most people on this call are the boots on the ground in doing that. So please take this as a thank you and a reason to understand why we need to keep moving forward locally.
If I can tack onto that, Devin, thank you for bringing that part up, because what does exist locally? Even if you don't have a SUID case registry in your region or jurisdiction, you likely have a child fatality review team. And if you have a child fatality review team, the likelihood that they're reviewing sleep-related infant deaths is fairly high. And so if you're able to connect with your region's child fatality review team and start building relationships there, it may be another way to get some of the data from who knows how many, half of your sleep-related infant deaths, a greater proportion than that. You won't really know until you make that connection and build that relationship.
Mm-hmm. So that sorry, can I start over? See, I told you it's live. So the great thing that happens when you have a story like that Lauren Kirshner did for Consumer Reports, that led to more coverage. And so I do want to talk for a minute about Dr. Howard being featured. Just like I say, these aren't statistics, these are babies. I hear myself saying all the time something that Mary Beth said, which is viral doesn't mean verified. So can you tell us a little bit about the conversation you had for this article, how you feel that the reporter tapped into what you were saying?
Certainly. So I think, knowing that this was going to be published on parents.com and it was going to be parents who were reading this, really tried to think about, what I could say that if a tired parent, like a mom in that picture that was with the Consumer Reports article, so a mom online in the middle of the night with her infant reads, what can I say to make them feel supported, not judged, and empower them with the knowledge to make sort of accurate and safe choices for their baby. And so it was really, when I talked to the reporter, I was really trying to emphasize the tension that parents are living in, right? They want to keep their babies safe, but there's so much competing information that they're getting from the hospital and from their primary care provider, and then from their family, from social media, from the moms groups they're in. And so viral doesn't mean verified, really, and was trying to put a tagline on that. One, parents are fluent in social media, but public health maybe isn't fluent in how parents learn, right? We may be miscommunicating there. And then also, again, didn't want to blame parents for adopting what they're seeing online. So hopefully the viral doesn't mean verified really reframes that issue, not just, parents are making the wrong choices for their infant, but it's that it's an information quality problem, right? It shifts the blame off the parents and onto the ecosystem that's feeding them the information, right? infant sleep and taking care of babies is so nuanced, where many media outlets, social media, the news want very simple binary rules and information, that it's challenging, and really tried to emphasize that just because you're seeing it online on social media, if it's going viral, doesn't necessarily mean that it's the safest choice for your baby.
And then I do want to take a minute, because if you have parents who are doing the best they can and working so hard to follow safe sleep, and then somebody gets sick, you had a great piece of research that was just published in Pediatrics. Can you just tell us the most important message from that research and what you learned?
Yeah, so really briefly, this came out of recognition that I, again, encounter these cases in the ED when they come in, and oftentimes we open up their medical record, and we see, oh, this baby was just here last week with a cold. And we knew, so during the triple-demic in 2021, 2022, we saw a very alarming surge in SUID cases here locally, many of whom had respiratory illness. And thinking about what's the mechanism through which illness increases a baby's SUID risk, we could hypothesize that there may be some physiologic change in arousal. They're congested. Maybe they're not waking up as easily. Or is it that something in their environment changes? Is it that parents see that they're congested and they're sleeping with them upright on their chest? They're bringing them into bed with them, things like that. And so we did this very small study, but surveyed caregivers as they were coming into the ED to ask them how their baby was sleeping before they got sick and how they were sleeping now that they were sick. And then we also contacted them 2 weeks and 1 month after their ED visit to ask them the same set of questions about how their baby was sleeping and measure a change over time. And what we found was that during illness, families reported increased bed sharing. More often, they were holding their babies to sleep rather than placing them in their crib, or using positioners, couches, recliners, adult beds to either watch their infant more carefully, or, as parents interpret it, help them with their symptoms. And so there was this temporary shift in their sleep practices. We hoped it was temporary, but then when we followed them up, we found that there was either their sleep practices changed to how they've been sleeping, or they continued to how they've been sleeping when they were sick, or they continued to decline. So parents realize that when they sleep with their baby in bed with them, or they hold them for sleep, maybe their baby sleeps better. And luckily for the infants in this study, nothing bad happened to them. And they continue to do that despite their infant recovering from the illness and it continuing to not be the safest place for their baby to sleep. Right. So parents, I think illness is really a critical time when a baby's risk of SUID is increased, and there's also an increased risk for deviating from safe sleep practices.
Yeah, it's an important piece of information. So there's a lot that happened in 2025. So as we're getting close, we only have about 10 more minutes. I can't believe it. If the people who are watching, if you can tell us a little bit about what you'll be doing in 2026.
For sure. I talked a little bit. First, I just want to say to you, Mary Beth, this study I'm so happy that you did this study. It's something, of course, I think we all suspected, but to have the evidence to show that, yeah, absolutely, it happens pretty routinely that sleep practice changes. It helps return us to remembering that every encounter in the highest risk period, right? The first 12 months of life, but particularly the first 6 months of life, is a chance for safe sleep promotion, for asking those deeper questions and getting beyond what we always talk about, getting beyond the ABCs, right? Why do you, tell me more about that? Oh, where are you sleeping, et cetera. So thank you so much for doing the study. It also really reinforces the idea around it takes all of us, right? It takes the ER physician who's seeing that baby for a sick visit, and it takes, the pediatrician who's seeing that baby after the sick visit to say oh, let's talk again about safe sleep, especially since she's just coming through this cold that she's had, et cetera. In 2026, I think I talked already about how we're going to continue on with getting the data back to clinical providers. But another thing that we really focused on in 2025 was providing safe sleep trainings to community agencies supporting pregnant and postpartum families. So it's another big piece of what we'll be doing in 2026 as well, much in line with kind of what you are finding that you're doing there too, Devin, in terms of developing trainings for different agencies and different providers that are supporting pregnant and parenting families.
Anybody else? Anything that you're looking forward to in
Well,
2020?
can I just say something really fast too?
Say
Mary
anything
Beth,
you want.
I
We can
did,
go long too. We can, if
I,
you guys have time, we can do a little bit
I
more.
also loved your article for everything that Dr. Lowell just mentioned too, but it's also making me think quite a bit about why are upper respiratory infections associated with sleep-related infant death? Because there has always been this little signal that they seem to be. And I'm seems to me that the information is heading towards it's really how the cold changes sleep behaviors most likely is the big thing because we almost never see a baby in a crib or bassinet sleeping safely die, at least in Cook County, and they get colds too. All of them get colds. They just are in a bassinet or a crib and they don't die. So it's making me really think about that getting a cold changes sleep behavior and then there's a death. And that's most likely the large driver of that mechanism, it seems to me. But Dr. Lowell and I work together. So the things that she just mentioned are the things for our group. The more we can get back this information to providers, keep getting back the information to birthing hospitals, find opportunities to get this out. We had a nice release of our 5-year report in October and had a press event and did get a nice bunch of press on the radio, front page of the Chicago Tribune, and we found a way to get some press. But I think we'll keep on seeing what we can do to have this get out there so parents are better prepared.
Can I add one other thing I think we're excited about too, is some of the work that we're doing to really understand the biomechanics of bed sharing. You were just talking about like, what's the mechanism that happens when a baby's brought into bed? They've got a cold, they're brought into bed, etc. We also really want to just fundamentally understand, like, how does a parent and baby being in bed together asleep, what's all the movement that happens? What are the shifts during the night? What are the levels of arousal and not with the parent, the baby? How does the bed itself, right, contribute to the sleep environment? A number of things. And so we're actually working with Dr. Mannon from the Baby Lab in Boise, Idaho, to really better understand the biomechanics of bed sharing infants. I'm very excited about that for 2026.
Maybe you can give us a little preview at the conference, just an idea.
It'd be great.
And how about you, Dr. Howard?
Yeah, I think I love venues like this because I oftentimes feel like I'm working in my own little bubble. But everyone's doing so many wonderful things in terms of prevention in this space. In my own little bubble, right? I work in the ED. That's my sort of medical clinical home, thinking about how to put this in what we found in the study into practice. And so having illness specific messaging that addresses some of the common concerns that we heard in this survey. And then we're also following it up with some interviews with families that come into the ED to develop tailored messaging that can be delivered not just in the ED, but at every, like Dr. Lowell said, at every encounter with an infant during their first 6 months when we know they're at highest risk. So in the ED, in urgent cares, if they're admitted, when first responders or home visiting programs encounter them, have some messaging that really addresses barriers and even conflicting information that families may be hearing online or through other venues. That help support parents, right, during very stressful times, such as when their baby's sick, to make the safest choice for their baby. I think bigger picture sort of within that, we talked a little bit about applying more of an injury prevention framework to this. And so thinking about SUID, like we think about gunshot homicides and motor vehicle collisions, taking the sort of onus off of the families to make the right choices and think about what system-based changes we can make to support children and save babies' lives in this space.
Yeah. I feel some positive movement, really, no matter what happened in 2025 in terms of on the federal level. With recent coverage, we've got some national convening that's going to happen this year. We're all developing expanded resources. We had a great success story from a program that we did with our paramedics in Pittsburgh that, again, speaks to Dr. Lowell and Dr. Quinlan, all of you talking about everybody that talks with baby or talks with families. How are we supporting them and starting to see some impact in that? So I don't know if we have time. We usually do our magic wand. I know last year Dr. Lowell's was some affordable housing. Sadly, that doesn't seem to be happening. I know Dr. Quinlan talked about some national media coverage. We've got a little. Wouldn't it be great if there was a giant ticker right up there as you asked for? That's still something to do. How about you, Dr. Howard? Any magic wand if you had that you could wave it when it comes to unsafe sleep deaths and injuries?
I really think I'll go back to just the system that supports families. Right? It's so challenging to be a parent in 2026 and to raise a baby safely, and really just a magic wand that makes it easier for families struggling with these decisions about how to put their baby to sleep, whether to vaccinate them. There's so many decisions that a parent has to make, and I think as a field, as public health practitioners, I would really like to figure out a way to make it easier for them.
Yeah, that's a good one. Anything to add before we wrap up, you guys?
I totally agree with you, Dr. Howard. I think that the social safety net is so important and has been under such threat for our families. And my magic wand would be to fully protect the social safety net from threats. That's what I'd do with it.
I have one more to add, and I really appreciate both of your guys' comments and thoughts. And before we finish, Devin, I want to thank you for having us again. But my new magic wand hope would be, or wish would be, for us to have a monstrously exciting and successful social media influencer, content creator that is so viral and everybody adores and is all over the place and people love and follow and focuses on let's protect the babies and does their magic with the content of keeping babies safe.
Wouldn't that be great? Oh, let's hope, right? Or let's see what we can do to identify somebody like that, right? 10, we could find 10 maybe, who knows? But yeah, that's a really good one because that's where people are going for information. And if they see on there that how to do it safely, let's hope, right? But again, you guys, you're the best. Thank you so much. Your time, your perspective, your expertise. Any of you that are watching live, remember, type those questions in for the docs before you go, because we're going to get ready to wrap up. See, too fast of an hour. So thank you so much, Kyran, Gina, Mary Beth. Can't wait. Can't wait to work with you more this year. So if you've joined us before, you know that we end each webinar with 3 things: a call to action, registering for the next webinar, and our Safe Sleep Lullaby Just Baby. The primary action item for today is super simple. Sign up for Cribs for Kids e-newsletters and follow us on social media, or both. You can do both. We have so much going on this year. It's how we're going to share with everybody what's happening and when. So besides rolling out our new professional training series modules for nurses and doulas, opening abstract submission and registration for our fall conference, we're launching a new assessment tool, the Cribette Conversation Guide, and we're introducing a new zip-in bassinet cribette. How about that? All cool stuff. Everything we're doing is shared in the Safe Sleep Spotlight monthly e-newsletter, posted on Facebook, Insta, LinkedIn. Side action item: complete one of the professional training units: child welfare worker, home visitor, child care worker, first responder. They are all available now. And this one I'm really excited about. Next, our spring webinar registration. Our next quarterly Safe Sleep Champions webinar is Thursday, April 16th. And look at that cute baby up there. It is National Wear Your PJs to Work Day. It is. So We are going to use at Cribs for Kids, not just to wear our PJs to work. I'm sort of close today, I feel like, but not quite, but also to promote safe sleep awareness. Thanks to Andrea, we have a great page on our site dedicated to Wear Your PJs to Work Day. And you can even use it as a fundraiser for where you work, right? Kind of like the 20th century version of Jeans Day. Does anybody remember that at all? So you could do a fundraiser of Wear Your PJs to Work Day. So for the webinar on April 16th, PJ's Day, our champion guests are going to talk about how they support families who would like to be sleeping while they're wearing those PJs. What are we doing to support families to help their infants sleep safely for their first year and especially that fourth trimester? Some real nuts and bolts pieces of information. We'll also be releasing our nursing professional training series modules and our new Cribette conversation guide for needs assessment. Lots of things happening. So that webinar registration will be up any second, April 16th. Remember, when you register for the webinar, even if you can't join us live, you will automatically be getting that email telling you when the webinar is up for viewing on demand. We hope that you'll join us for both on April 16th, though, the webinar and Wear Those PJs to Work Day. And finally, Just Baby, a Safe Sleep Lullaby. Like our other safe sleep resources, it is free thanks to the partner purchases of our safe sleep products that you see here. Every time you buy something from us, you are helping to fund all the resources that you hear us talk about. You can find our lullaby and more via our partner recess portal link that's under our partner menu item on our website. As you listen to Just Baby, think about how you might be able to use it in the work that you do. We know so many people have so many great ideas out there. Thank you again to my coworkers, Andrea, Kelly, and Shayla, and our champion guests, Doctors Quinlan, Lowell, and Howard. As always, thank you to all of you who are watching, because it's that time and commitment that you share with us that one day, every baby's going to wake from every sleep. Remember, if you have that question, go ahead and put it in the Q&A as the lullaby plays. We're still on, and that Q&A will be open. And then look for that email from in a week or so with the questions, answers, and the link to the upload. You guys, thanks so much. Happy New Year.
Bassinet or play yard. this baby.